Well, let's talk to Sir Iain Duncan Smith about this. He's obviously former Conservative Party leader and current Tory MP, and one of those rebels we've been hearing so much about. 100 rebels apparently set to vote against the 10 p.m. curfew next week if the government tries to continue with that for the whole of the country of England. So, Iain, the combination of all this new information about the prospect of yet more curfews and lockdowns of pubs and restaurants across England and obviously already happening in Scotland, with this new information from Edinburgh University, this computer simulation published in the BMJ, which suggests that actually strict lockdowns extend and prolong pandemics. They prevent the build-up of herd immunity. They may actually increase the death count, not cut it. Does this suggest that the government has now just totally decided to ignore science in all of its policy making?
No, it depends what you mean by ignoring science or being in favour of it, and depends what the science is really. One of the problems we've got right now is that we don't appear to be looking back at the last lockdown to figure out what did it do and what didn't it do. The evidence now is pretty clear that before we locked down, the infection rate had already plateaued. And 2 weeks later, the death rate plateaued, and then it slowly started to fall. So the question really is, what do we do to make sure that the infections don't spread? Now, hand washing, if it makes people feel better, face masks, these sort of things are all vitally important, they're the key. But there are some of these areas which I really don't think we need to go back into. A full lockdown or locking out all of the hospitality sector, I don't think changes everything very much, because most of the hospitality sector is incredibly well run and actually less likely than people, for example, gathering in large groups at home. So we need a little bit more balance on this. And the second thing is really the balance of risk. We sort of lost the balance of risk, because what we've done now is keep this rhetoric of save the NHS. What it means is that we focus almost exclusively now, if we're not careful, on coronavirus. And so many other ailments, diseases and problems then go missing within the health system. So cancer patients, heart disease, dialysis. There are plenty of people even now who have strokes who are scared stiff about going into hospital because they're scared about getting coronavirus. And if they don't go to hospital, their likelihood of dying, or for that matter being severely damaged by the stroke, are massively increased. So the balance is where I think we have to be, and understand there is a balance in the nature of human ailments, and it's not just one thing.
And this is the thing, isn't it? Whenever I sort of talk about this in public or tweet about it on social media, people say, don't you care about people dying? It's like, yes, I do. I care desperately about people dying. But we are, as you say, we are talking about people dying of cancer and heart disease because they're not getting treated because of this. And then we're told, well, we can't. I mean, Matthew Hancock, the health secretary, said the other day, we can't basically make sure our hospitals are able to treat all of these cases for other ailments unless we've defeated coronavirus. But we all know we're not going to defeat the virus. That's not how viruses work. There have been viruses we've been living with for centuries, and they've not been defeated yet. We are going to have to learn to live with this. This new study from Edinburgh University suggests that, and again, I don't think this means the government got it wrong and made bad choices. At the time, with the information they had, I think that first lockdown did feel like the right thing, I think, to do. But as you say, looking back and learning and being willing to see where things go wrong and where things go right, learning from that experience, it is quite clear now that the evidence is that if you do a strict lockdown, the countries that did the strictest lockdowns, the Spains and Peru and others around the world, they have actually seen the biggest second wave, such as it is a second wave, and more cases. Do you think that the government is just too afraid to say, we're going to just have to learn to cope with this, and as long as our hospitals aren't overwhelmed, and as long as we carry on social distancing, washing our hands, wearing masks and the like, we are going to have to just sort of get on out there and live life as best we can whilst shielding the vulnerable and the elderly? Do they just not have the courage to be honest with us?
Well, I think the problem is actually it's not really the government that's got the courage. I think what we've got now is a problem with the scientific group, SAGE. I mean, I begin to wonder whether they're not guilty of groupthink. So that means basically that they're driving each other down to the lowest possible common denominator, not wanting to be the one that turns around and says, do you know what, I think there's a better way to do it, because that way they expose themselves if something goes wrong. So I think there is an element of this idea that scientists, which has been banging around for some time now, that scientists are exact, accurate, know what they're doing, and we should do everything that they say, actually is being proved to be quite wrong. Just like economists, you get different opinions and different views. And I think the biggest problem is, for example, right now, we are in a better position than we were in March. We now have new antivirals coming in, which I think are much more important in a way than this idea that we're going to get a vaccine, because antivirals suppress the condition, give you a much greater chance in those risk groups of surviving. So I think what has been proposed by Professor Gupta and Hennigan and others at Oxford, now in the Edinburgh survey, and by 8,000 scientists globally, that they say, look, the thing about this virus is we know who it targets. It targets people with comorbidities. Fewer than 4% of all of those who've lost their lives, fewer, have died with no known comorbidities globally. So we know that this peculiar virus doesn't actually attack the young, doesn't attack these people who are reasonably fit and healthy, including people in their 70s and 80s. And we know the average global death rate is around 80. So now we know then
the age of death. The
age of death is around 80. So we know who to protect. So the key question is, should we not put our resources into making sure that those who are at risk have the greatest protection, the greatest support? And for the rest of us, a combination of social distancing, hand washing, and importantly, bringing in those antivirals so that those who have any symptoms at all can take antivirals as a precautionary feature, which would allow us to keep things like pubs, restaurants, and hospitality open. More than that, actually to start thinking about opening up football grounds even to a slightly lesser audience, as they do in Germany.
Yeah.
So I think that's the balance of risk. After all, if you're under 40, it is more likely you will die on a bicycle than you will from coronavirus. So we need to get the balance of risks right. We live by a balance of risks, not one risk alone.
Absolutely. I mean, just finally, looking at the risks to the government of a rebellion next week, a vote on the 10 p.m. curfew. It was supposed to be this week, but it's got moved to next week. Up to 100 Tory MPs apparently could rebel on that. There's now the possibility, it's being set up by the Labour leader Keir Starmer, that there could be a vote against the measure by the Labour Party after he asked at PMQs yesterday for the scientific backing for the 10 p.m. curfew rule. And the Prime Minister offered none. And we know that SAGE, the committee advising the government, hasn't been asked to provide any scientific backup. Would a compromise, such as it would be of an 11 p.m. closure, would that suffice to stave off that rebellion? Or do you think we will see that rule, that law, basically torn up next week?
It's quite difficult, really, to tell. But here's where the problem arises with an arbitrary 10 p.m. I was in a restaurant the other day with some friends. We got there late. We'd been voting to have supper. And before we'd completely finished, suddenly the clock struck 10 and the restaurateur asked us to leave immediately. We left immediately with others. So we then all kind of stood around in the street. And my view about an arbitrary single line closure means you're actually more likely if two things are going to happen. First of all, people are going to order in more drinks to get their drinks in early, which they used to do when we used to have the old 10 p.m. shut. And at the same time, they're all going to empty out onto the street together. So that's exactly what the government says they're trying to avoid. And I'm told that they have common sense view about this rather than scientific. Well, I think a common sense view would be, look, if you want hospitality to close at a certain point, then give them a bit more flexibility. Say, look, at 10:30, you need to close, but we give you half an hour's leeway for people to leave in separate table groups slowly over that half an hour, so they don't all congregate outside and go home. Not just an absolute drop-dead line where everybody goes out. Little flexibilities like this will help the hospitality industry and actually make more common sense.
Yeah, well, again, I think more common sense would be just to give what the local councils are asking for, the powers that they can close down those pubs and restaurants that aren't enforcing the social distancing measures, and leave everyone else to get on with their lives. Sir Iain Duncan Smith, former Conservative Party leader, MP, thank you very much indeed for joining us.